committed a year ago to ending veteran homelessness in this country in 5 years. And I think you all were the first to sign up for that. And I'll talk a little bit about what we've done in the interim. But I just want to be sure this is the same audience I spoke to last year. So when I say fire, when I say ready to go, I'd like to hear fired up from all of you. Okay? Ready to go? So will we. Ready to go? Okay. Well, it's great to be back here again. And George, thanks for that kind introduction. I'm grateful for this opportunity to take up the cause of Gerald Washington and this coalition, and I look forward to our continuing work together. Thanks also to John Driscoll, your president and CEO. John, it's great to see you back in action, and you're a big part of this organization. Your leadership is important for the goals that we have all set for ourselves. So it's good to have you back. Barbara Poppy, with whom I work on the ICH, good to see you again. Members of the coalition, your staff, and your board of directors, partners, colleagues, fellow veterans, other distinguished guests, ladies and gentlemen. I am so proud of this coalition. Congratulations on your 20th anniversary, especially those of you who were here at the beginning. Now, I want to ask you to raise your hands, but I know that there are a number of you in the room. You have a lot to celebrate, starting with something like 16 members. You now number 275, and you can count on another 2,100 organizations which rely on you for advice and assistance, including VA. You are the leading authority on homeless veterans in this country and are still the only national organization dedicated solely to helping homeless veterans. You fought hard and won greater involvement by government. You've increased critical funding for veterans homeless initiatives such as VA's Grant Per Diem program, and most importantly, you've made real differences in the lives of tens of thousands of veterans. 6 years ago, 195,000 veterans lived on the streets of America. Today, that estimate is about 107,000. Much of this progress is due to the collaboration between those of you who are here, your coalition members. Sort of the creative geniuses, as I refer to you, the creative geniuses in this effort. Collaboration between you and the various local, state, and federal agencies who support your initiatives. That collaboration has been nurtured by this coalition, and we at VA are pleased and are proud to join you as partners in this crucial effort. Caring for those who cannot care for themselves is a long-standing tradition in this country. Threads of selflessness that are woven into our national character. Our nation's veterans who come from every town and village in this great land are a vital part of that fabric. In honoring their service, VA keeps faith with Abraham Lincoln's promise to care for those who have borne the battle and their families. And nowhere is our obligation to them more important, more visible, or more necessary than in our commitment to end veteran homelessness. For over 20 years now, VA has been involved in street outreach, residential and transitional housing services, vocational rehabilitation, access to primary and mental health care, counseling for substance abuse, assistance with benefits for those who qualify. But while noble, our efforts lack sufficient coordination, sufficient synchronization, and lack the kind of focus that was needed on objective outcomes. In some ways, we were committed to better managing homelessness, not ending it. We must focus our efforts and energies, improve our collaboration, and end the indignity of veteran homelessness. Last year, I committed VA to this fight to end veteran homelessness in 5 years. We've had a year to think about it. So what's the verdict? Can we do it?
Yeah.
we don't think we can, we won't. It's in this room that the magic happens. And that's why I refer to you all as the creative geniuses in this effort, because you're on the ground, you're in the communities, you know the veterans, you know how to reach them, and you know how to get them to come for our help. So I'm appealing to you to put your best efforts forward. Last year, we began putting together a comprehensive plan, along with the other members of the ICH, with interim goals that serve as milestones for measuring our progress on how we're going to end veteran homelessness in 5 years. We're in the process of resourcing that plan. 2010 is done. This is 2010. You're executing it. 2011 is before the Congress, and we will begin working the 2012 and 2013 budget pieces beginning this fall. When I say you're executing the 2010 budget we funded, what I mean is that President Obama invested $3.4 billion in the Homeless Veterans Program for this year. $3.4 billion. Just so you know how that breaks out, 85% of those dollars are going to health care, not just general medical and dental health, but most importantly, to those mental health issues we're all familiar with: depression, PTSD, TBI, substance abuse, suicide prevention. The remaining 15% of the 2010 dollars, about $500 million, has been invested in housing and counseling programs that get homeless veterans off the streets and into safe housing. And that's primarily what you all touch. Our 2011 budget request, which is before the Congress right now, boosts overall funding to help homeless veterans by over 23%. So it'll be an increase. And this is the President's doing. We go from $3.4 billion in 2010 to $4.2 billion next year. Housing-specific investments would go from $500 million this year to $799, almost $800 million next year, a 60% increase to touch the programs you all are involved in. Now, resources are moving in the right direction, thanks to the President. But you and I have more work to do. You and I have more work to do. It isn't just about money, although money is a critical issue here. And more isn't better. Better is better. And we have to figure that out.
Yeah, right.
We have to be smarter about how we use these resources while we have them, and put in place the relationships, the procedures, and the disciplines that get 99 cents out of every dollar impacting homeless veterans. Here, goodness is not one organization's agenda, but what's best for our homeless veterans. We must move to excellence in our collaborative efforts, and there's work that we all can do. Now, thanks to the President of the Congress, the 2010 budget and 2011 budget requests provide us the resources to address what we think, or at least what I've heard from veterans, as 3 key issues. This is what I hear about most as I go around and interact with veterans. Increasing access to our services and benefits, reducing the claims backlog. But the third thing they talk about is ending veterans' homelessness in the next 5 years, and that's what we're involved with. Last year we held a national summit on ending veteran homelessness. A number of you were there. Following that conference, we have written a detailed 5-year plan to achieve that objective, one that emphasizes prevention rather than rescue, and ensures a no wrong door philosophy for veterans in need of help. Veterans who are at risk of homelessness or who have just crossed into homelessness must have immediate access to our programs and services, regardless of which facility, which door they enter. Any door that veteran chooses, whether it's a medical center, a regional office, a vet center, a community organization. That entry